idea originated with talks with Amy and Patrick Kennedy over the summer about the need for increased student mental health services. Amy shared a program panel that was hosted in Delaware with a friend and a colleague, Delaware's Lieutenant Governor, Bethany Hall Law, on improving student social and emotional behavioral health. I'm Assemblywoman Shavonda Sumter. This is a topic that is near and dear to my heart. When we started having these conversations, I decided to call on my friends to join me in making sure that we bring this issue to the forefront and that we were prepared as a state to address the social, emotional, and mental wellness needs of our students. I thought that this program was a program that we could host here and include our partners in the mental health ecosystem, such as Najama and our school-based providers. We spent several months to prepare this program that you will hear today. Thank you to all of our partners, and especially the Great Falls Youth Center here in Patterson, where we are located today, to Bob Barachi, who's watching virtually, Dave Gilman and his team for allowing us to host the webinar here, to Mary Abrams, Lauren Fink, Samantha Cerrito, Shayla Vivis, and Judith Finellis. It is our hope that at the conclusion of the roundtable, we will have action steps for this budget cycle in the state of New Jersey to improve mental health. With that, we're going to hear from a dear friend, Dr. Deborah Wentz.
Thank you, Assemblywoman Sumter, for that gracious introduction and for having invited the New Jersey Association of Mental Health and Addiction Agencies to participate. I also want to extend our deepest appreciation to you, Judith Finellis and your team, Amy Kennedy and her team, as well as Mary Abrams and my team for planning this roundtable. I'm so pleased to join with you in the Kennedy Forum to focus on the urgent need for school-based mental health services for New Jersey's youth. As U.S. Surgeon General Dr. Vivek Murthy stated in the introduction to his advisory, Protecting Youth Mental Health, that was published in December 2021, every child's path to adulthood is different and different. Many face added challenges along the way, often beyond their control. There's no map, and the road is never straight. But the challenges today's generation of young people face are unprecedented and uniquely hard to navigate. And the effect these challenges have had on their mental health is devastating. Dr. Murthy sums up the situation well. In his report, he shares recommendations for what various individuals and organizations involved with youth can do to strengthen mental health and resilience. The statistics from before and after the pandemic, staggering increases in depression, anxiety, and suicidality quantify how dire the situation is and indicate how much worse it could become if sufficient funding and effective policies are not in place. While the numbers are distressing, it is heartening that we've convened today to strategize on how to forestall these heartbreaking trends by concentrating on school mental health. Even before the COVID-19 pandemic, mental, emotional, developmental, and behavioral disorders were present in approximately 1 out of every 5 children ages 3 to 17. As reported in the Surgeon General's report, from 2009 to 2019, there was a 40% increase in the number of high school students reporting persistent feelings of sadness or hopelessness. And within this group, 36% had seriously considered taking their lives.
What is even more tragic is that completed suicides among 10 to 24-year-olds increased by 57% between 2007 and 2018. COVID-19 clearly exacerbated existing challenges and imposed new obstacles for youth throughout New Jersey and the nation. It is also clear that children and youth were in great need of services and supports prior to the pandemic. But after the pandemic, being physically isolated from friends, unable to attend school or participate in social activities, and having to struggle with health inequities and racism are especially difficult and debilitating for school-aged children and youth who are still developing socially and emotionally. Here in New Jersey in 2020, hospitals saw a 74% increase in anxiety diagnoses and an 84% increase in depression diagnoses for youth 17 and younger. Throughout 2021, our children's mobile response programs received a record number of referrals, with acuity levels requiring an equal record number of dispatches. Just yesterday, Department of Children and Families Commissioner Beyer, testifying before the Senate Education Committee on School Mental Health, reported that there were 4,021 children's mobile response dispatches in just the prior 30 days. As a result, the distressing statistics continue their upward trend. The recently published America's School Mental Health Report Card by the Hopeful Futures Campaign, a coalition of national organizations, including the Kennedy Forum, shows that New Jersey is on the right track in addressing school mental health. However, much more work needs to be done, and much more investment is required. While we are all aware of the dearth of child psychiatrists and advanced practice nurses, it may be less widely known how bad the shortages of mental health staff in schools are. For example, New Jersey has one school psychologist for every 731 students, when 1 to 500 is recommended. And we have one school social worker for every 655 students, compared to the recommended 1 to 250. All of this is why we are here today, to hear about and explore solutions. I look forward to hearing from our roundtable panelists and to working with Assemblywoman Sumter, Amy Kennedy, schools, families, students, providers, and all other stakeholders to rapidly implement urgently needed services and supports for New Jersey's children and youth. And with that, I will turn the floor back over to Assemblywoman Sumter.
Thank you. Thank you, Dr. Wentz. As this is a virtual program, I have the good honor of going a little bit backwards because I skipped a very important part of the program, and that is the introduction of Dr. Wentz. She is the president and CEO of the New Jersey Association of Mental Health and Addiction Agencies. She's also the executive director of its 501c3, the New Jersey Mental Health Institute. The JAMA represents 160 behavioral healthcare provider organizations. New Jersey Mental Health Institute promotes equal access to quality mental health and substance use services through development of policies and best practices, training, research, and anti-stigma and anti-discrimination campaigns. Dr. Wentz improves the lives by changing views about mental health, which you heard today, and addictions, and government and corporate leaders, the media and public through innovative and persuasive advocacy, communications, and education. We are pleased that she's here in New Jersey applying a global perspective. Following the tsunami in Southeast Asia in 2004, Dr. Winston developed the Sri Lanka Mental Health Relief Project through New Jersey Mental Health Institute with a local non-governmental organization, NGO. Closer to home, Dr. Winston developed the Changing Minds Advancing Mental Health for Hispanic program, which resulted in state regulatory requirements for continuing education units and cultural diversity. Dr. Wynn serves on numerous boards and communities, including several National Council for Mental Wellbeing Committees, New Jersey Mental Health Work Group, Department of Education, New Jersey's Multicultural Service Advisory Committee, Healthy New Jersey 2030 Workshop, and multiple committees of the New Jersey Business and Industry Association. She has held many state and national appointments, currently is the chair of the Governor's Council on Mental Health Stigma. Previous appointment includes the Governor's Council on Alcoholism and Drug Abuse, having served on transition teams for many administrations, most recently with Governor Murphy's transition team. Dr. Wentz earned her doctoral degree from the University of Paris, France, a second PhD and MA degree from the University of Connecticut, an executive MBA from the Alternative Careers Program of Wharton Business School, University of Pennsylvania, and a BA from the Gloucester College. We are pleased that she was able to join us and partner with us to serve our mental health ecosystem here in the state of New Jersey. As we begin our program, I'm going to ask those of you joining us virtually that you put your questions in the chat. We have a team that's prepared to lift the questions out of the chat, and I will share it with the panelist, who's an expert panelist, that will be able to address your questions. We do have some folks here with us in the audience, so we feel confident that they'll have some questions and share in the ecosystem that we're trying to build. At this time, I'd like to share a little bit about the priorities for the New Jersey Legislature. At the end of the session last year, Majority Leader Louis Greenwald, who's a staunch advocate and friend to the mental health system in New Jersey, supported legislation that created grant programs to encourage school districts to partner with institutions of higher education in training school-based mental health service providers. You heard from Dr. Wentz about the grave needs and the need for specialists in this industry to service our students. Additionally, we came up with a program that requires the Division of Children and Family Services to give priority to certain school districts with student mental health counseling centers and awarding grants under school-based youth services. I'm pleased to report that last Tuesday we heard Governor Murphy's 2023 budget address. That budget, and I want you to hear me clear because I always trip over this, is a $48.9 billion with a B budget. $48.9 billion with a B budget. The good news is New Jersey has money. The fun news is we get to fight over how we spend it. More than 40% of the state budget will be distributed through school aid to districts or municipal aid payments to towns and cities across New Jersey, appropriations in the tune of $20.8 billion. Over half of the remaining budget, or 29.9% of the total, is used by the state government to purchase services that directly benefit residents in need. These services, which include health care coverage for low-income residents and community-based support services for those with disabilities, are categorized as grants and aid in total $14.6 billion. That's billion with a B. I didn't say millions. We moved from millions. We're now into billions. Mental health and addiction services, what we're talking about today. The governor's intent is to work with the legislature, and I am glad, a term that we use in the church circles, that we're going to work on developing student mental health and success initiatives with the American Rescue Plan funds to help students of all ages who have been impacted by the pandemic. The budget also maintains substance abuse disorder programs, which will be supplemented by over $640 million over the next 18 years through settlement funds from the opioid manufacturers and wholesalers. So it's incumbent upon us sitting on this panel, you and our audience, to be sure that we are good stewards of these funds to support these dire needs for our vulnerable populations. Additional supports for community safety and inclusion. The budget proposes continued commitments to violence-based intervention programs with community partners. Additionally, the American Rescue Plan elementary and secondary school emergency relief funds gave to the department $276 million in state set-aside assets. The funding was largely allocated to districts for programs to accelerate learning, provide mental health supports, and provide professional learning opportunities for educators to better meet the needs of our students. School districts in New Jersey received over $2 billion in direct allocations from the federal government. The Department of Education has made available over $70 million in ARP emergency assistance non-public schools dollars to support the state's non-public elementary and secondary schools. So we really tried to cover all of our bases in making sure we were servicing the students and those in need in our great state. We will work in a bicameral, executive, and bipartisan strategy to provide funds that support access to mental health services for students directly and connect students with mental health providers in their community, which are some of you that are viewing this webinar. So I'm excited about the future of the New Jersey mental health ecosystem. However, as we begin to look at what our wish lists are, I'd like for you to hear from some of our panelists who are here today. I'm going to go down the panel to have them introduce themselves, and I'll start with Dr. Amy Kennedy, right to my right.
I got an upgrade.
You got an upgrade, forgive me.
That's all right. I'm Amy Kennedy. I'm a resident of New Jersey, and as mentioned earlier, I am Education Director for the Kennedy Forum, as well as serving on the Executive Board of Mental Health America, and I'm so glad to see other Mental Health America members here. And I also serve as an advisor for the JED Foundation. I started my career as a public school teacher where I spent a decade here in New Jersey, and now I have 5 kids who are part of the public school system. So I'm glad to be here to talk about this. We've looked very hard at what federal policy could look like, but it's very personal to me that we see what New Jersey could be doing better, because as I mentioned, having my own kids in school and knowing what the statistics are of 1 in 5, we know we'll need it too. So thanks for having me today. Jacques.
Thank you, Assemblywoman Sumter. Thank you, Amy Kennedy and the Kennedy Foundation. Thanks to Deb Lentz and her staff at Najama for having and inviting me to this forum. My name is Jacques Harishko. I'm CEO of Family Connections, and a mental health and substance use provider. We are fortunate enough to have school-based youth services programs in 3 school districts and in 5 schools in Essex County. And very pleased to be here today.
Denise.
Hi everyone, I'm Denise CHR, and thank you very much for inviting me today. I feel very honored to be part of this panel. I also live in New Jersey and raised my children here. Back in 2010, I started to open up the first full-service community school health center in Patterson, along with my husband George. And we started at School 5 here, and unfortunately a few years later he passed away, and I was left to, what am I going to do? You know, am I going to be able to keep this going and continue? And subsequently we now have 7 school-based health clinics in Patterson, and I've become so involved these past several years, 10 years, in really understanding the community and really understanding the needs of schools, not only for our children, but our caregivers, our teachers, our staff, our principal. It is so much larger, mental health, that goes way beyond the child and the student. And I'm really pleased to be here to share my experiences this past 10 years in building school-based health centers here in Patterson. Thank you.
Great, thank you. So without further ado, we will start with our first question. And Jacques, since you are the gentleman brave enough to join us here, so we're going to elevate our voice so we project so they can hear us all the way wherever they are in the Zoom world. All right, so what are the benefits of having a community-based provider deliver school-based services?
I really appreciate that question. I appreciate the fact that the question assumes that this is not an either-or situation. Meeting the needs of the school districts, meeting the needs of the families, meeting the needs of the schools, we need to have all the resources of the community, and that means the providers as well as the schools. So we need to work together to meet this need. What are the benefits of bringing mental health providers? Well, I think as a mental health provider, a community-based provider, and a community-based provider that's been in the community for over 140 years, I think that there are a number of benefits. First, I just want to talk a little bit about school-based programs. The purpose and the goal of school-based programs is to keep youth in school, to keep youth engaged in school. And to do this, this needs to be a partnership between the agency and the school district. And for us, Family Connections, this partnership begins when we write our proposal. We work with the school district to talk with them about the needs, the gaps, and what they would like the school-based youth services program to accomplish in their school district. We not only talk to the school administration, but we talk to the students. We form a committee, an advisory committee of students who really guide our proposal. And in fact, the students name our programs. They often help design the space, and they help design the curriculum. What we want, both the school, Family Connections, as well as the students, one of the first things that the school district does is give us a space in the school. And that is such a privilege because we all know about the space shortages that are in school. And for the schools to designate a space in the school to a community agency, we are very honored to have that privilege. And we design that space. We design that space with the students. And what we want to happen is a student to walk into that space and say, you know, I woke up this morning and there was nothing in the school that I was interested in. There was nothing that I was looking forward to. I walked into this space and this doesn't feel like school. This feels like something different. This feels like a place I want to be. And then when they look around further and they see other students there, other students that are enjoying themselves, and then when they begin to meet our staff whose goal is to pull them into a school program, and then to make connections in the school. That's the purpose of the school-based program. And a benefit that a provider in the community has is we are not the school. And that the students know that. And students who are falling through the cracks, who need an opportunity to reboot, if you will, can come into our space and easily see that opportunity.
Thank you. Thank you. Denise, same question.
Okay, I have 7 school-based health clinics, and we provide mental health, pediatrics, dental, vision, optical services, audiology services. The purpose is, I guess I can explain it this way. Back in about 10 years ago, I received a master's in holistic nutrition, and my goal and my passion was to try to bring wellness into the schools. In our school-based health clinic, we have a room inside the school, and we provide these services by outside subcontractors that come in. We have right now presently 8 licensed clinical social workers, 13 interns from Columbia, NYU, Rutgers, Montclair State, and they come into the school and it's a philosophy. We partner with our lead agency partners. The CDC is one of our partners in 2 of our schools, and I have to say the model works. And I have to say that it takes a village, really, to raise our children to be happy and successful. If you think for a moment sitting in class and not being able to see, or feeling anxiety and stress during the day, it's really great to have one of our therapists to come in and to do some mindfulness, deregulation, taking the kids, talking to the teachers, talking to the students. It's a philosophy where we integrate our services inside the schools. We go to principal meetings, guidance meetings. We work very closely with our lead agency partners, where they have psych coordinators along with my treatment coordinators at the school. And we give wraparound services to the families. What is the need they need? Social, emotional, and I just think that this model is such a wonderful, strong model for schools. I think the fact that we're able to, as he so eloquently put, we're a partner. Sometimes families may not want, the school to understand or know that there's something going on in their home. So there's, this contact and this connection that you have where, you can keep it private, you can keep it within the home, but there's support inside the schools to reach out to these families, to reach out to the students. And being so integrated into the school and talking to the teachers and talking to guidance. And I have to tell you, everyone from the teachers to guidance, to the principals, to the child study team, to the lunch aides, to the security. There's so many eyes on our children that really want to help them, and there's such true love in the schools, and our kids are in school, and they trust the school. They trust the teachers. They trust who they go to every day. And I have to say, over these past 10 years, I've grown so much myself as a person seeing these children that have so many issues coming into school with big happy smiles on their face when they are there and they're learning. We're in a community of, I think, over 187,000 people in Patterson right now. And if you think about the fact that there's, X amount of doctors, X amount of clinicians. I know during the pandemic, our phones are ringing off the hook. I had to give counseling to my treatment coordinators because of the devastation that they experienced inside our community. It was like mental health issues on steroids. I mean, I can't even begin to tell you, which we are still feeling on a daily basis. And the fact that, as explained, one guidance counselor, one psychologist in school has a team that they could refer to for help. We could go into the classrooms, we do group, we do individual counseling. We are there for the students. We see them once a day, once a week, twice a week, 3 times a week. They're getting a lot of support inside the schools. And I really feel so strongly about school-based health clinics in New Jersey. I feel that it is such, it's that middle ground. There's a lot in New Jersey right now where school-based health clinics really aren't recognized as they are in other states. There's 48 states that are part of the School-Based Health Alliance, and a lot of them exist through relationships with health departments, federally qualified health clinics, and hospitals. But I really feel that there's a great need in our school to get licensed individually, because we are that layer, that middle layer of connection into greater help into the community. For instance, we don't prescribe medication in our school-based health clinics, we refer out. We help the children as much as we can, and if it's a higher level of care that they need, we help integrate them into a community. There's a lot going on. I mean, not only is mental health an issue itself, but there is so much political anxiety over the state of the world right now. I know 3 years ago, in 2016, well, more than 3 years ago, when we had the Syrian refugees come over here, we went into one of our schools, 9, and we weren't a school-based health clinic, but I asked if we can go in and give support. And these children were running down the hall when they heard the school alarm, the bell go off, because they thought they were going to, there was air raids. Families were coming over that did not speak English, and they were thrown into a culture where they couldn't understand, they couldn't read the information. So we helped them navigate on how to get the care that they need and access the health, the social work and the care that they need. We were able to get a student in a wheelchair who had his legs blown off because he stepped on a mine. During the pandemic, not only did we go through the pandemic, but we also went through the Israeli, the conflict, and we gave support through courageous conversations to our families that were reaching out because their children are living in split worlds. What they see on TV with their relatives in other countries, and what they're experiencing here and getting up every day and going to the classroom with all this stress on them. So the stress is multi-layered, and we're able to offer to the families courageous conversations. During the pandemic, we did Wellness Wednesdays, and we kind of modeled it after Hurricane Katrina. There was a program, Fleur de Lis, where they kind of put a blanket over the community of a place where people could come for comfort and food and supplies and to talk about their anxiety. Because the stress is with our students, but it's the family, it's the community, it's the things going on that we have to be able to integrate into our schools here in New Jersey and offer the support through community agency partners and school-based health clinics. It is so needed right now because you have the advantage of it being supportive services inside the schools. And I'm just very grateful to be here and be able to speak about how important it is to have school-based health centers inside of schools.
Great, thank you. And I'm going to ask everyone to raise their voice up and use an outside voice because we want to be sure that everyone's able to hear clearly, especially the impact stories because they connect the purpose to what we're doing. So now no pressure, Amy, it's on you.
Use my teacher voice. There you go. So, for me, to be able to see the partnerships between schools and community partners is really the key for what we could hope as a model going forward. We know that, as Denise mentioned, it is the school community, the staff within the building, not just the teachers, but all the educators, the support staff, the crossing guards that are connecting with those students. And that's the place where they're spending the most time. So being able to have students identified or referred in school, but knowing that they may not be able to meet all of the demands in the school. Teachers right now are stressed themselves. They're saying an average of 55% of teachers are considering leaving the profession. We need to bring in other supports and partnerships and other professionals that can help meet the demands not only of the students, but of the staff as well. When we're able to bring in or make those partnerships, there can be a continuum of care. So as students are identified, they can have those wraparound services that connect the families as well to support. It can also help bridge that gap when it comes to billing. So when we think about how these young people, whether they are privately insured or on Medicaid, could be billed, the community partner can do that billing. We also need to identify schools as a site of service for that billing. It's something that we could be addressing before stage 4. So Mental Health America's tagline has always been before stage 4. So that means right now we're at a crisis when it comes to mental health. And we don't do that with other health issues. We don't wait until it's a stage 4 before we start treatment protocols. We need kids to have a checkup from the neck up, just like at the wellness center they might get a vision check. Just like they might go down to the nurse and get their height checked. We need to have those interventions right at the place where they're spending their time during their day because it will allow for greater adherence to those appointments. It will allow for us to provide those supports and then integrate them into the classroom to help them be more successful. So all of these things together will be key, but one of the areas where we need to make some adjustments in New Jersey is in our expansion of Medicaid. That was allowed starting in 2014, but New Jersey has yet to do that state plan amendment. And that means right now only students who have an IUP and are Medicaid eligible can bill for those services. We need to create those sustainable funding sources Because even though that budget sounds really great, we know how the dollars go. And we have to allocate those funds specifically for this need because it is not just COVID. This has been a long-term issue that we've seen, and it's continuing to worsen. Over the past decade, we've seen the number of suicide attempts on the rise. We've seen the number of people identifying as having anxiety, depression, and other mental illnesses on the rise. And if we take these steps today, and we'll, I know, outline even more that we could be doing, I know we can get kids on this path to early intervention and prevention, because that is possible. Prevention, recovery, interventions are all where we need to be focused.
Great, thank you. And I just want you all to know, we have Warren High School on Hunterdon, Pemberton, Red Bank, Ocean. We have St. Clair's listening, Summit, John F. Kennedy. So you do have some listeners out there, and that's just all that I can see really quickly scrolling on an iPad and trying to listen in, but they're tuned in. It's going to be incumbent upon all of us to make sure we go out and advocate post this roundtable. So the purpose is not just for us to be a talking soundboard or to join each other in unison, which we do in mental health all the time, and have our own group therapy. But it's about going out and doing the work that needs to be done to make sure the resources are allocated to their proper place and space in this time and season. My next question, I'm going to go back down to you, Denise, because your model for JFK, and I need you to talk loud for me. You have that soft voice. She's definitely a worker bee, but you secured $2.5 million from the federal government to support this effort. You talked a little bit about school-based health systems and full wellness, but tell us what the partnership means and leveraging those partnerships with the public, private, because that's where you came from, and our federal government and state working together for the resources that are needed, and telling the story of the students that you serve.
Wow. Actually, my kids would say that I speak really loud. Okay, well, I guess, so at John F. Kennedy High School, we are partnered with the CDC. And what we do is, I guess the best way to explain this, for mental health purposes, we created something called the living room. And in the living room, as my social worker would say, is it's where life happens. We have a lot of students that come into the living room, and they are in group individual counseling. We have LGBTQ groups. We have so many different groups, and it gives the kids an opportunity to come into a space which is not like a school, but a living room, and just really talk about what's going on in their lives, what's troubling them in their lives. I want to go back to the model of school-based health, and I just really want to say that in Middlesex County, and this is really amazing, back when the pandemic first started, as part of the School-Based Health Alliance, we were working around the clock, 24 hours writing letters to try to become part of the stimulus package for school-based health. In I want to say 2019, there was a school-based health bill that was up for reauthorization. And back then, a bunch of us from our school-based health centers all across the 48 states went to Capitol Hill, and I personally went to our 12 congressmen's offices to talk about school-based health. And I have to say, Senator Frank Pallone, and I hope I'm pronouncing his name properly, but I never got the Congressman, I'm sorry, Congressman Pallone. I didn't really get to meet him personally, but he, through the work of his interns in his office, actually this past September was on the Senate floor, and he spoke about school-based health clinics and how important they are to be in the community. And it was just such an honor to be able to think that in a little way I was part of this push towards school-based health in school. It's about mental health, but mental health doesn't stand alone. Giving our children wraparound services, prevention is the key. And we found out something really important during the pandemic, and that was that we were overstressing our hospitals for simple things like it's asthma attack is not a simple thing, but where it could be handled in a school environment where there's a pediatrician or a nurse practitioner, diabetes, medication, and to take care of the uninsured. There is a very large population of uninsured because we are this beautiful country and people are coming here to make a better life out of themselves. And we are going to start to get immigrants from Ukraine, and they're going to come here. And we have to be prepared for this. And we have to be able to offer our children these services in the schools. I remember, we need a renaissance towards when immigrants first came to the United States, and the school is where they got education, they got health care, they got knowledge, they were given the tools to navigate. Now we're in computers. During the pandemic, how many families in Patterson that didn't have computers, that didn't have internet access? Our treatment coordinators, our staff, I know my lead agency partners were going to homes to help families during the crisis. So, my point is it is about school-based health. It's making sure our kids are healthy and in school. And I have to say, we were just going over our members since November, and in 7 schools, I think we were able to help children in one way or the other. About 4,000 kids have been taken care of in school-based health centers since the beginning. And during the pandemic, we really felt that it was about the families, helping the families. Our mental health counselors spent a lot of time with our families on the phone because it just seemed to be so many crises happening. But I have to say, our Wellness Wednesdays and our talks, we had a lot of teachers online because they were experiencing their own pain and their own suffering, as well as dealing with the crisis in school. And it's just not about crisis in the pandemic. It's about crisis in everyday life that our children and our families, our teachers are so exposed to. So being able to integrate into the schools and giving support to the teachers and giving support to the staff and as well as the children is a beautiful thing when you have a full-service community school that's able to cater to the needs of the families and the students and the staff.
Thank you for that. And thank you.
Did I answer your question?
You did. You met with all 12 congressional leaders to share what these programs are and what they mean. And for an elected official to be able to speak to these programs, it adds more passion to the testimony for their colleagues to know the value of these services, especially when you don't have enough professionals that you can hire. So it's important that the federal government supports us in these efforts. So thank you for that. Jacques, same question as you're with an agency, Family Connections, that has over 100-year history in servicing these vulnerable needs and also working with the private sector to fund some of these needs as well. Please.
Thank you. Funding school-based youth services programs. I'd like to, before we talk about additional Medicaid funding and private insurance funding, I'd like to talk a little bit about existing funding. School-based youth services funds are provided by the state of New Jersey. We're so fortunate to have that funding, and New Jersey is one of the very few states that was so forward-thinking in creating and funding this model. But these contracts, as well as any of our state contracts, have not seen an increase since 2008. Yes, we're very fortunate to have had some one-time funds since then, but our contract level base rate still is at the 2008 level. The world has changed since 2008. In 2008, the agency had a service billing software system that cost us $10,000. And that sounds like a lot of money, $10,000 to be able to buy a software system so that you can bill for services. Well, today, because of mandates, we're required to have an electronic health record. And that electronic health record can't just sit by itself, but it needs an entire software platform of firewalls and additional software systems just to exist. So annually now in our budget, over $200,000 on computer software just to be able to bill and document our services. Those expenses didn't exist back in 2008. Today, to maintain that software system, we have a computer staff, an IT division of 4 staff people. Those were staff that we didn't have and expenses that we didn't have in 2008. So the cost of delivering services has gone up so much in the state of New Jersey and elsewhere. And Amy, as you said, these problems haven't just existed since the pandemic. This funding issue has been around for a long time. And even in 2008, there were challenges to the funding level. But there is also one unique piece on the school-based program. If we look at the revenues that we receive for that program and our expense, the state and auditing requirements require us to identify across the board what our general and administrative expenses would be. Those are expenses like an IT department, like a human resources department, like a finance department. Those need to be identified, and those need to be put into the columns of each program. However, the state does not allow us to charge those administrative expenses to the revenues of the program. And so what this means for Family Connections is we have a contract, a school-based contract that is based on 2008 levels, but is running a deficit of $100,000 right from the beginning because we could not charge real expenses to the revenues. So how can we survive? We have to fundraise. And again, what that means is the first $100,000 of our fundraising needs to go to support a contract that, because of regulations, starts out in the red. I'm going to say this is not sustainable. This is not sustainable, especially during the time of the Great Resignation. Our school-based programs, we are so proud of our staff satisfaction, the time that staff stayed with us, and certainly our school-based programs had staff that wanted to stay in the program and work in the program for a long time. However, with this Great Resignation that's happening across the country, our school-based programs, like others, are seeing resignations and people moving on and people wanting to know and making decisions that whether this can be something that they can continue to work in. We have to raise the salaries of our school-based staff. So that's the beginning. Absolutely, Medicaid billing and private insurance, what that does is allows more services, more revenue to be brought into the funding stream for school-based service. And I just also want to add, we know that to provide the robust level of services and the amount of services and the scope of services that we want, because we know that this is what's needed in our students. And I'm talking about prevention programs, I'm talking about wraparound programs. We need to get funding from every source as possible. So we write a lot of grants to support our programs. So school-based programs work hard at leveraging the funding that they have to get more funding to provide additional resources to the school.
Great, okay, Denise?
Is it all right, can I come on a bit as well?
He's gonna go.
Sure. Is that okay?
Yeah, I want to add to
Yeah,
that.
I actually wanted to add to this because I spent a year with the director of Medicaid in a kind of a think tank group. And we were discussing, in fact, school-based health clinics in New Jersey right now. And I will read something that New Jersey Administrative Code 6A16-101. No formalized program to add established clinics on health centers in campus for schools presently. So there isn't. So how we've been operating in our school-based health clinic is our independent doctor can come into a clinic that is not licensed if we're not connected with an FQHC or a healthcare for up to 8 hours a week in one school. So our doctors do the rounds. They bill themselves. They bill Medicaid themselves. So what happened is we initially won the full service community school grant and money for a health clinic, and that lasts for 4 years. We're in an amazing community where Patterson has allocated Board of Education money to help sustain the health clinics here. But my point is that in order to be completely sustainable, we need to be able to have our providers bill independently to Medicaid for their services. So back in, I want to say maybe 5 years ago, I spoke to the managed care groups that the director of Medicaid would invite me every year to speak, and we were able to now bill without children having to change their PCP in order to get preventative health care. And I say this because I want to say when I first did the numbers, like maybe 4 or 5 years ago, it cost the average person $980 to walk into a hospital. So when you think about how much money could be saved if that ear check was in a school-based health clinic for $35 a visit by a doctor, how many more children we can take care of with that money while not overtaxing our hospitals, and the beds could be open for the people that really need the care and the attention. And COVID really taught us that in numbers and droves, where there were, the National Guard called into some hospitals to try to help navigate where these people were going to be put in what room. So my point is that practicing prevention in school, it's a school first, right? So my argument is they shouldn't be able to, to take care of every issue, but there's that layer that's so important. Right now, in order to be a freestanding school-based health clinic, you have to follow the rules of an ambulatory care facility. But we're in old buildings that were built many, many, many years ago, and we can't spend millions of dollars, and why should we? There's so many children that need help today that a clinic to set up in a school really is not a lot of money to do that, and to get outside providers to come in to offer the services. There is a certain amount of prevention and a great amount of care that can be taken care of in the schools. We don't have the funding for security to stay till 9 or 10 o'clock at night to follow the rules and regulations. And also our parents don't want to walk in certain communities that late at night. So you want to be able to take care of the children during the school day. And I think we really need our Medicaid to really review, as you were saying, it needs to extend past IEPs. It needs to be, there's so many children that are waiting for IEPs. There's so many children that need care. Our families need independent health and wellness to be brought into the home, to understand nutrition and wellness. And there are certain things that you just really can't bill for, but the schools have to be able to provide the services in the schools.
Great, thank you. Amy?
Well, just to your point, it's so clear that the funding has not been sustainable and it isn't in place. And, for those people watching at home that aren't familiar with the parity law that passed in 2008 that says that your mental health provided should be covered the same way your physical health is covered, know that the reimbursements that you're getting for a mental health clinician is not equal to what physical health clinicians are receiving. So the first priority needs to be enforcing that parity law, that your brain's part of your body and we have to pay for it in the same way. And then the second thing that does is once those reimbursements are there, all of a sudden we don't see the staffing shortages, because who wants to go into a field where they know they're going to be making less than someone else with those same credentials in a similar field? So we need to get the pipeline of people that are trained and willing to do this work paid accordingly. And so that's that parity piece that we're talking about. Denise also talked about the cost of a late identification. But the reality is that when students first start to show symptoms to when they actually receive their first treatment is nearly a decade. And we know if it were anything else untreated, how that metastasizes. And so it's much more severe if they're not getting those interventions at first sign of trouble, right? We need to be able to do that right away. And what better place than within our schools? With the technology piece that you talked about, there's models out there in other states where we're seeing this done, just as you would hope. Where in Michigan, they added Bill 31N to their mental health bill that they passed that said that there needed to be a separate funding stream to set up a technology platform to connect the students with those services and be able to do this billing. And that is really difficult. So even if we expand Medicaid in the state, which we could just follow the language that's been done in 17 other states already, we also know that small schools are still going to struggle to do that billing. And we have a lot of small schools in this state. We're just a whole, every district for himself. And so that's cumbersome. It's difficult for any of these organizations that are our partners to do, and we need to be able to streamline that. And we need to see funding be able to go directly to those districts and not have the high state administrative burdens that are holding on to some of those Medicaid dollars. So if we're able to expand the Medicaid funding by doing the state plan amendment, we're going to see increases in the number of students who are able to get those services. In Michigan, that I mentioned, they saw a mental health staff increase of over 70% once they did that state plan amendment. And that means that we're better leveraging our federal dollars. So I'm excited to see New Jersey take that step. We're pushing for that. There's so many people that are working in coalition. If you wanted to take a look, I know we're going to move into Q&A, but if you haven't looked online at the Hopeful Futures campaign, they have a great resource that has our New Jersey scorecard along with all the other states. Michigan's listed as a model for some things. New Jersey, Florida, Texas, for their telemental health setup that they have there, are all listed as models, as well as a score of where we stand in New Jersey and what policy things we could do to really move this state forward. And so there's an opportunity to take some of the recommendations to our legislators and ask them to make a move on those. And that Hopeful Futures campaign is really a combination of all of those great organizations that have been working towards this for so long, like MHA and NAMI, Trevor Project and JED Foundation, UNICEF, Steve Fund, Kennedy Forum, that are thinking about things like social determinants of health, how we can move forward with culturally competent care, and how we can increase our community partnerships and connections.
Thank you for that, Amy. Also tuned in, I'm getting a bunch of texts and chats here. Trenton, Newark, Israel, Hackensack High School, Barringer School, St. Francis, Clifton High School. So we're getting some applause. Parity needs to be key, action needs to be effective. And they also want to be sure that we understand and emphasize that the program save money to the state, so make sure that we include that as part of our talking points. One of the questions we have, and I'm working with multiple devices here, is the system, and Jacques, I believe this is for you, that you spoke about for the EMR, EHR, or KIPCO, and what paperless systems you found to be more efficient and cost effective.
Okay,
Very technical.
yes, I'm going to, there are a number of electronic health records that are quality records. I think that the decision that an agency or a school district takes is a complex, needs to take in a lot of factors. I want to give a plug to Najama and Najama's IT project. They are very helpful in being able to present the options and a process in how to make a decision. Yes.
Thank you, Denise, and I'm sorry to the audience.
So I can actually touch on that as well. Really, although I outsource, my providers, they're on their own. We do work with a electronic medical record for mental health called Simple Practice. It is exactly that, Simple Practice. We haven't started billing through it, but that's where we keep all our process recordings and our notes and communication between the school, the counselors, the students. That's how we communicate. And for our pediatrics, we use Secure MD, which is a wonderful EHR. So,
Great.
Our electronic health record is NetSmart.
Okay, great. Thank you. So you heard it here first. I'm not sure which one to go with, but there are some options. As we moving swiftly as we can get in the weeds on these things. But we learned a lot during the pandemic, and one of the things I was excited about was what was once a barrier using telemental health in the state of New Jersey became the only portal that allowed our patients to remain stable and not have hospitalizations where they could not have because the beds were consumed with COVID patients. So what are some of the things that you all believe we can keep post this pandemic as a state that we should continue to move forward with? And I'll start with you, Amy.
Well, I think it's going to be very important that we maintain the flexibility with our telemental health because, it allows us to provide that culturally competent care and know that we can reach out. For my own child, I've used telemental health services and be able to bill for that with schools as a site of service. If we can do that, we're able to help reach those smaller school districts that maybe can't set up or have not set up a health center because, my kids go to school in a public school that is less than 500 students. It's not going to be opportune for a whole health center, but they may be able to do a service like this, and they may not have the full staffing that they need to meet some of those students' needs, but this may help with some of those other opportunities. So being able to use that telemental health really depends on the district and what their staffing needs are and the size, I believe, of their student population.
Thank you. Denise, did you want to add to what we can keep post this pandemic?
Yeah, I agree with mental health, absolutely. And telehealth, just at large, I think it's a wonderful tool. I first was put in front of the telehealth scene several years ago, and I thought, geez, this could really only take off, but will it take off? And luckily, in a sad way, we were able to realize, through the pandemic, through such, horrible experiences, that yes, telehealth is like a very good outlet for families to be able to utilize. What I do want to say is that school-based health clinics, there is no roadmap in the state of New Jersey, and 48 states, recognize school-based health clinics, and I would really like to see through all this, a director of the state to be able to have somebody, so all the other school districts out there that want to start having school-based health clinics have a toolkit and a roadmap. And I really believe that there needs to be a lot of work with Medicaid because for mental health services, an independent provider cannot bill Medicaid. You have to be part of a nonprofit organization. So right now, my licensed clinical social workers inside our school-based health clinics, we're not able to bill. We're depending on grant funding and district funding. And I think we really need to take a very close look at that because schools need licensed clinical social workers to be able to come in on the outside beside just a child that has an IEP and be able to offer mental health services in schools. I think we've grown so much these past 10 years in Patterson, understanding the need and really appreciating the fact that school-based health clinics keep kids in school and raise report card grades for the district, for the school, because when kids are in school, they're learning. And when they're happy, they're learning.
Great, thank you. Jacques, I'm going to give you this question. Just bear with me. What efforts are being made to not only increase the resources available to our youth in each school district county, but to pay master's level clinicians a meaningful salary commensurate with their experience and with validation of the important life-saving work they do? Second part, hiring and retaining good therapists and staff is virtually impossible if they work alongside other school staff who make almost double their salaries. It's demoralizing and embarrassing. The school-based staff who connect our youth to human services also need to access the same human services in order to survive and provide for their families.
You said my point exactly. It is a real challenge. It is a real challenge. And yes, we have many of our school-based clinicians who leave to go work with the school district. And to me, in many ways, yes, that means that the school so appreciates the work that our staff person has done, but it's a loss. And it is a shame that our school-based programs are not sustainable at this point. What can we do? All we can do is look at the resources that we get and try to figure out how we can put more and more, as much as we can, to staff salaries. And unfortunately, what this may mean is we have to cut costs everywhere else. We may not be able to provide as much trips to universities, to juniors or seniors who are wanting to visit schools. It may mean that we're not able to provide other, wraparound services. It is, without additional resources, sadly, it does mean something needs to be done.
Thank you. Amy, I find that there is a gap in communication between school-based services and district support staff, such as counselors, psychologists, and student assistants, coordinators. The gap is larger with private and community mental health partners. What can be done to bridge supports?
I think it's going to be really important that the school staff first be recognized for their certifications and be maximized, because we don't have enough of them, right? School counselors, there's a shortage. So it's not just a shortage of having those partnerships. We don't have enough psychologists, counselors, and so being able to maximize them based on what they can do will mean they have more time to be able to do those meetings and join together for IEPs. If they are focusing on testing, other administrative duties, even career planning, instead of being able to work with the students on their behavioral health, then we're not going to see the same level of communication. So they're overworked. Our ratios in New Jersey are not where they need to be in the number of staff. Every school in this state does not have the school counselor, the school psychologist. That was just a recent law made in Delaware to ensure that each school has that, as well as a proposal that they have now in Delaware that every student be getting a mental health checkup at their pediatrician. So those are things that we can start to look to other states as we're searching for answers. But I think our ratios are part of that problem. They just don't have enough time in the day to do this work. And we've got to make sure that there is time built in to have those conversations, because they all want to be part of it.
Absolutely. So as we begin to wrap up, and of course I got notes all over the place, just some of the takeaways that I have is, of course, working with, and I know some of the members of the Division of Children and Family Services are listening online, expanding our state plan for Medicaid. That's something that we can do, and I'm going to call on our partners to make sure that we work to move that needle, because those are matching dollars that we send to the federal government that the state can match, that can be sowed in good soil for this purpose. Taking a look at the state contract rate, not moving since 2008. The thing I love about mental health and service providers is we don't complain. We work with a heart of service, and as I've learned growing up in public and private schools, charity does not mean you do not make a profit and cover your expenses. So again, making sure that we're advocating for the resources that we need for this industry, which we as legislators all care about, but know that we need skilled professionals to fund and pay decent wages to support it. I also have the cost of technology, where again, even moving into using, if we're talking about telehealth and telemental health, you need equipment that's secured and resources and firewalls and all that good stuff. And now I think we can put some costs to those very real expenses to come of age to service the population today. I'd also advocate that our children are computer savvy. And instead of talking, prefer to text and communicate that way with all these acronyms things that I'm still learning because I think new ones come out every day, as well as different emojis and avatars and all that good stuff. So us as a generation of clinicians and service providers really bridging that generational gap to make sure that we're coming of age to connect with our young people. Administrative expenses as well that you can't charge for, that you're fundraising for. And I know I talk to providers in our community that struggle with the same exact thing to survive, and executives go without compensation just to support direct workers to thrive in this space. The Great Resignation, we talk about it, but don't realize the impact, especially in this service industry, where there are, barely cost of living increases in this industry. So I want to amplify that. And extend the IEPs and being able to get them done, because there's not enough neurologists who can complete them when schools are calling for a plan to be done. And sometimes the students are well graduated from the school system where you can actually set them up with life-sustaining resources and techniques. And looking at the Michigan plan, I would definitely do that because Amy's going to make sure that I do that. And then really just making sure that schools are a site for service and recognizing it's a safety net, but taking care of the well-being of the family. And then figuring out, if it's federal or state, how to build for clinicians on site and create, again, an open market in this space, if not a virtual market. So that's the work that I have. As you give your closing remarks, I would ask that you feel free to unload. It was hard for us to consolidate our focus for this roundtable because literally the needs are so great and we're all doing such great work. But if you can help focus us with closing remarks so that we'll have work product and work plan to move forward with. Thank you. And we'll start with you, Meg.
Oh, thanks. I think that as we talk about funding, we know that when we lay out a multi-tiered system of support, and we can identify what that should look like at every level. What does prevention, social emotional learning, early interventions look like? What is tier 2 supposed to look like? And tier 3 interventions, we will assign evidence-based practices to each of those levels, and that's something that we should be willing to pay for. If we know that it's evidence-based, if we know that there is a level and a designation that goes again to that communication of who's responsible for what in the building, do we have a really clear MTSS plan? Do we have technical assistance from the state for the districts on how to implement this? Do we have the funding that can be relied on? So that, yes, we've got the ESSER funds, yes, we got the rescue plan dollars that were significant, but if they dry up in 2 years, who can build out a real solid plan for their district, knowing that that won't be there? It has to be reliable. And how do we do this in a way that's going to cover as many students as possible, knowing that not every kid that's struggling right now even needs an IEP, right? They're not all going to be qualifying for IEPs. So we need to build out a funding stream that's going to be long-term, know that kids will pass through this. We go through periods where we're in distress. We go through periods where we're healthy and in recovery and able to be successful. And so we want to have the pieces in place for wherever our students fall at a given time, knowing that that is a critical time when mental health diagnoses are formed, right? That middle school period is when we start to see this happen. And so if we can screen at transitions that are difficult through our children's lives, and if we can build out the training for our staff on site, we'll be able to catch it early, and we'll be able to put in the interventions that will lead to healthier adults and really a better workforce that's going to be able to support New Jersey in the future.
Great, thank you.
Thanks.
So I'm realizing that it was almost 2 years ago to the day that our agency closed its doors to in-office services and started providing our services remotely. And the terror that we were all feeling about what was coming with this virus, what was going to be happening. And we worked so hard, as all the agencies in New Jersey did, to pivot so that we could provide virtual services. One of the first things that we realized was so many of our individuals, so many of our families not only didn't have the computer expertise, but they didn't have the computers. So we had to scramble and get funding, federal funding, corporate funding to buy computers, and we were able to give any family who needed a computer, a laptop. We were also thankful that the governor passed a waiver to allow us to provide this telehealth service, because before that, telehealth services wasn't allowable. So what have we learned in the last 2 years? We as an agency learned that some people really like telehealth services, that this meets their need, that many individuals would not reach out in person, but were able to reach out via telehealth. Telehealth needs to continue. And in order to have telehealth in place, it needed a waiver. I'm going to also say that so many of what we've talked about here this morning has been a theme of that we need flexibility. We need flexibility in being able to bill from different locations, to being able to bill for different services. Because right now, the services that we can bill for are treatment services, psychiatric and treatment services. And so much of what we've been talking about today, prevention and wraparound services and social determinants of health services, those aren't billable. So we can't be just delusion in thinking that billing Medicaid as it exists now is going to solve the problem. It's not. There is so much else that is needed. So in looking at that, what's also needed is a look at all the regulations, the licensing regulations, the site licensing regulations, and the billing requirements to make a system that was created decades ago work for us today. So to conclude, I wanted to read a letter. I wanted to read a letter that we just received from a student in one of our school-based programs. And I could talk on and on about the importance and the significance of school-based services. But I think if it can be said by a student, those are words much more eloquent than mine. And just before I read the services, just one other piece. As far as prevention, as far as wraparound, we've talked a lot about high school. These services are needed in middle schools, they're needed in preschools, they're needed in elementary schools. So that flexibility, being able to provide support services in the full scope of the child's education. So this is from a student. As the year comes to an end, we usually get assigned by the school district to reflect on who has impacted us the most throughout our school career. I always get stumped on who to pick to write about, especially this year because the pandemic is still going on and the quarantine that happened. There are a lot of people that I would want to express my thanks to by writing to them. However, the first person in the organization that comes to mind would be my therapist and counselor, Ms. Yu, from the SPACE program, a school-based program. And I just want to say, I am not reading this program to brag about a Family Connection school-based program. I know because, and we all know because of the list of students that are writing in right now, that this is a sentiment that is across the state of New Jersey. However, the first person in the organization that comes to mind would be my therapist and counselor, Ms. Yu, and the SPACE program, a school-based program. Both she and the other staff members have been working really hard to help lots of students have a better, more enjoyable and exciting school year. especially during the quarantine when many students were stuck at home and couldn't go outside as often as they would like to. Ms. Yu ensured that we were able to have unique experiences despite the pandemic. By working with Ms. Yu, it really helped impact my mental health in a positive way. Of the staff members at the zone and space programs I meet with Ms. Yu I meet with Ms. Yu more frequently since she is my therapist and counselor. The pride that the students talks about in having a therapist, having a counselor, the normalization of receiving mental health services is okay, and it's healthy and good. When we couldn't have in-person meetups anymore, over the phone sessions or teletherapy were such a huge relief to have. I was able to continue to talk to her about what was troubling me. And together, we worked together to help me be more mindful about my mental health and identify how I felt and why I might feel that way, as well as taking the time to celebrate my accomplishments that are academically and outside of school. Working with Ms. Yu really helped me accounting for that my voice, as well as other students' voices, was being heard. She helped other students and myself engage in activities hosted by the zone and space programs whenever possible. The group activities that we did virtually were a big motivation and gave me a boost in self-esteem and serotonin levels, because I got the opportunity to continue communicating and socializing with other students. It also made me appreciate the social interactions we were able to have with each other prior to the pandemic's devastation. It was also an eye-opener to how in-person interactions were precious and to appreciate them more. Truly, Ms. Yu has been so positively impactful in my life in a few years that I have known her. And since then, I began knowing her better, and I hope to continue to do so in the next year as well.
Thank you. Thank you. It's beautiful. Denise?
Wow, that was beautiful. I mean it. Wow. Okay, have to recover from that. That's amazing. I guess, the last thought I really want to express is, this past year, $30 million has been dedicated for school-based health clinics. Recently, for March 9th, I received this from the School-Based Health Alliance, and it's going to go towards schools that are, school-based health clinics that are affiliated as partner with federally qualified health clinics. Which means that we are not going to receive any of this funding. So my question is, what happens when federally qualified health clinics or hospitals do not want to partner with school-based health clinics for one reason or another? I think the state of New Jersey really has to look very closely on designating and licensing freestanding school-based health clinics and have someone designated to oversee that so that more schools will be able to offer these wraparound services for the students and be able to bill Medicaid and to be able to take care of the family. The family needs so much support, and we could really take care of so many more children that way. Our school-based health clinics are in elementary school, middle school, 1 middle school, 5 elementary schools, and a high school. And I've been fortunate to see students from our elementary school in School 5, which is our first school-based health clinic, now in John F. Kennedy. And they've continued with their school-based health. And it's really been an amazing to watch these families and to see how much they appreciate the services in the school. But furthermore, and in closing, I want to say that I hope that a lot of the districts that are out there can look into the School-Based Health Alliance. It's School-Based Health for All. And I have been trying to start a New Jersey alliance for a long time, because you'll see that 48 states have an alliance in school-based health, and we really need one in our state of New Jersey. So I think a coalition really needs to be formed to be able to support all these school districts that can really benefit from school-based health. Thank you.
Great. And I just truly want to thank everyone. I'm Assemblywoman Shavonda Sumter. People in the chat have connected. They've shared email addresses. As you know, we always do in the mental health community. I think the connection to purpose is hearing a student destigmatize the value of therapy using serotonin levels, and really just valuing their clinician, and that's the heart of a good clinician. Also, I want to thank the Kennedy Forum. I want to thank Najama for sharing resources with us today that's invaluable to move New Jersey forward. I also want to thank NJCDC for allowing us to be in the space that we're in today, which is actually a student space, as we saw some students walking through during the day. And truly to the team that pulled this together, this will be available online on our different platforms. We'll share it with our partners, and thank you to all the folks who joined online. Again, we'll stay in touch, and let's get ready to advocate. Thank you.